I'm going to talk to you about the skeletal anatomy relevant to lumbar facet joint injections or facet joint medial branch blocks. The scanning technique would be using a curvilinear probe. As we know, curvilinear probe has a wide field of vision and will allow you to look at the deeper structures. I usually start putting the ultrasound probe in a longitudinal orientation on the sacrum, and you will find that the sacrum ends and you will find a gap between the sacrum and the L5, which is the L5-S1 space. Once you have located the L5-S1 space, you'll be able to locate the L4-L5 space, L3-L4 space, and so on. The another way to scan for the levels will be a transfer scanning, where you place the ultrasound probe on the sacrum, where you will be able to see very much a flat sacrum with the medial sacral crest. Once you have moved the probe proximally, you will then be able to locate the L5 spinous process, which will come into your view. Followed by this, then you move up on the spinous process. Given that the spinous process will not allow the ultrasound beam to go through, you will only be able to see the bony silhouette of the L5. Once you move the probe slightly more proximal, you will be between the two spinous process looking at the interspinous ligament. Given that the interspinous ligament is a soft tissue structure, it will allow the ultrasound beam to penetrate, and you'll be able to look for the intrathecal space. Once you have located this, I would then move the ultrasound probe more laterally, looking at the lamina and the inferior articular process and the superior articular process, and the gap between the two articular process will be your structure of interest, which is the facet joint. Once you moved ultrasound probe slightly more laterally, you will also be able to locate the transverse process of the corresponding vertebra. When it comes to performing the medial branch blocks, you could either perform a medial branch block using an out-of-plane technique, where you have your target, which is the junction of the transverse process and the superior articular process. To perform the facet joint injection, you can also perform this with an out-of-plane technique, bringing the needle between the two articular process, trying to aim for the joint. Majority of times, you would be able to do a periarticular injection rather than the true intra-articular injection. Another way to target the medial branches or the facet joints would be in plane technique, bringing the needle in plane, going into the joint, and also bringing needle in plane, going for the junction of the transverse process and the superior articular process, which will target the medial branch of the supplying to the facet joint. The only thing you will have to confirm when you're performing a medial branch block is to use a longitudinal scan, making sure that your needle is on the proximal part of the transverse process and not on the distal part of the transverse process. It should be located on the proximal aspect on each vertebral level to make it a true medial branch block. If your needle is not on the proximal part and it's more at the distal part, then you have more likelihood of moving the needle and heading towards the nerve root of the lumbar level. Hence, it's very important to double check once you have put your needle at the junction of the superior articular process and the transverse process, move the ultrasound probe, looking at longitudinally and making sure your needle is on the proximal aspect of the transverse process. Thank you. I'm going to tell you about the ultrasound guided lumbar facet joint medial branch blocks and ultrasound guided lumbar facet joint periarticular injections. To perform this injection, the patient will be laying prone with ideally pillow under the abdomen in order to take the lumbar lordosis. Based on the patient's body habitus, you will have to set up the depth settings and the resolution settings on the ultrasound. To start counting the levels, there are two ways to do this. You could hold the probe horizontally, looking at the medial sacral crest, and as you could see, you have a medial sacral crest and you have the posterior superior iliac spine that's just coming in the view. So keeping an eye on the medial sacral crest, we are moving up, and suddenly you will find the medial sacral crest disappears, and it is telling you that you are actually at the L5-S1 level. You can keep moving up till you see L5 vertebral spinous process. Given that it's a spinous process, it's just a bright dot, and you won't see anything below the spinous process because the bone will not allow the ultrasound beam to pass through. Then we will move up, and now we are in the interspinous space between the L4 and L5, and here you could see the intrathecal space along with the other structures that are of interest to us. This is the spinous process, and this is the lamina, and now you can see the superior articular process, inferior articular process, and a facet joint. Here in this image, I will draw that for you. So this is a spinous process. This is a side of the spinous process. You have the inferior articular process. You have a superior articular process, and this is the facet joint. This is your target. So if you bring the needle in and put the needle, you will be able to perform periarticular injection of the facet joint. To perform the medial branch block, you will have to make sure that there is a bony landmark with nothing below. That's telling you are looking at the transverse process. So let me show that to you now. So we have a spinous process. This is the spinous process with nothing below. Now we have the interspinous view, and we have the facet joint view, and now we have a transverse process view. And now in this particular image, you would see this is the superior articular process, transverse process, bringing the needle in plane and putting it at the junction of the superior articular process and the transverse process will give rise to the medial branch block. 0.5 to 0.8 cc of local anesthetic is enough to do a diagnostic block. Once you have done a diagnostic block, the one more point to consider is to check the image in the longitudinal view, and there are 3 longitudinal views. When you palpate the spinous process, you will see the spinous process of the lumbar spine in this particular view, followed by this. When you move lateral, you will be able to see the articular pillar view. This is the articular pillar, and then once you tilt the probe slightly inside, this is called as paramedian oblique sagittal view, looking at the intrathecal space and the dura and ligamentum flavum complex. Followed by this, once you move slightly more lateral, you will only be able to see the transverse processes, and this is called as a trident view. So transverse process along with, so I'll freeze the image. So we have a transverse process, transverse process, transverse process. Between the two transverse processes, you have psoas muscle, and on the top of the transverse process, you have erector spinae muscle. You want to make sure your needle that you have put for medial branch is on the proximal aspect or superior aspect of the transverse process and not the inferior aspect of the transverse process. This is not what you're looking for. So if your needle is here, you will take the needle out and you will position the needle in the proximal aspect of the transverse process to perform a successful lumbar facet joint medial branch block.